Did you know that hypothyroidism may be related to infertility? The thyroid glandule is a gland located in the front part of the neck, where the well-known Adam's apple is, which is much more pronounced in men than women. Women don't usually have it. It regulates the other hormones in the body. This gland is responsible for releasing a hormone called thyrotrophin. Thyrotrophin is related to the other sex hormones in the body of both men and women. This hormone, when altered, produces disorders in the release of female hormones. This disorder in follicle development, growth and maturation causes a failure to ovulate properly. And after ovulation, what remains of the follicle is called yellow body, which is produced by the hormone progesterone. Progesterone will cause the egg to settle and attach to the back of the uterus. Hypothyroidism disorders, meaning a decrease in the production of thyroid hormone, or hyperthyroidism disorders, where there is an excess of this same hormone caused by the thyroid gland, cause disorders in the balance of sex hormones. Thus, a woman may not ovulate properly, and may have a hard time achieving a cycle. Hypothyroidism involves another hormone called prolactin. Hyperprolactinemia usually occurs when the patient has hypothyroidism. You may know this increased hormone, prolactin, because it increases a lot when a woman is breastfeeding. As we see it in the laboratory, high prolactin levels of 100, it is when the development of the ducts and lobules of the mammary gland to produce milk secretion takes place. When prolactin is very high, it generally causes FSH and LH not to be released properly when there is hypothyroidism. These two hormones are produced by the hypothalamus and the pituitary gland. FSH, the follicle-stimulating hormone, once released, stimulates the follicles to grow, develop, and achieve ovulation. LH is the one that will cause the highest peak of FSH, which precedes ovulation. It happens 24 hours before. If all this is deregulated, because there is a disorder in the thyroid gland that produces this imbalance in the sex hormones, cases of infertility occur. Many times, women do not know they have hypothyroidism, and are trying to get pregnant. Having normal sperm from their partner, and with practically a normal cycle, they are unable to get pregnant. This is because of this hormone that remains very high. It is very easy to diagnose, because it is all done via a laboratory test, and it is also very easy to fix it. Generally, patients with hypothyroidism who present many symptoms, such as lethargy, bradycardia, weight gain due to hypothyroidism, are patients that are more tired. The same applies to hyperthyroidism. When this hormone is increased, it produces disorders in the cycle, and they are very easy to fix, because they can be solved with medical treatment, and one can get the menstrual cycle back on track. While this may serve as a guide, it is crucial that you go to your doctor when you notice any signs or symptoms of what I have told you that may suggest hypothyroidism, or if you are trying to get pregnant.